the response of the Labour Party to the NHS Bill, and which we'll be speaking about after I show this clip from the Shadow Health Minister, which was last week.
But the reason why we are particularly concerned with this bill is the power grab clauses for the Secretary of State. He is creating 138 new powers, including 7 allowing him to effectively rewrite the law in future through secondary legislation to transfer functions between its arm's length bodies without any proper scrutiny. And he has not explained why he needs these powers or given any guidance on how he expects to use them. And these powers also include a requirement that ministers are informed of every single service change, of every single reconfiguration, and the Secretary of State will then decide whether or not to call them in for ministerial decision. Are you sure you want that power, Secretary of State? Now, because the Secretary of State has gone from wanting to liberate the NHS under Lansley to now listening out for the clang of every dropped bedpan echoing through Whitehall.
I saw that clip and it didn't mean anything to me in relation to what we'd spoken about on the show a couple of weeks ago with Dr Bob Gill about the potential for this bill to actually destroy the NHS. It looked like a bit of parliamentary tete-a-tete, kind of trying to fire some kind of wit across the dispatch box. Bob, Dr Bob Gill here. Bob, what do you make of Jonathan Ashworth's response there?
Hi, Crispin. Thanks for inviting me on again. It's a totally pathetic response, and it's continuing what we're being served up on a weekly basis, which is parliamentary theatre. The reality is that over the last 40 years, more and more state function, public services have drifted into the control of the private sector. He almost mocks the phrase, I think it originated from Aaron Bevan, about the bedpans dropping that would ring in Whitehall. And he's arguing against the wrong thing. Now, the reason the Secretary of State is wanting to assume more powers is so that he can have a political handle on whatever's going on. So if there's a reconfiguration or cuts and closures in a Tory area, he'll be able to directly, personally manage the fallout from that. So he needs to micromanage this final phase of the privatization. But what Ashworth and the shadow cabinet failed to say is that this bill will end the NHS as a provider of healthcare. Everything is to be outsourced, even the control of the budgets. The elephant in the room, which nobody mentions in Parliament, is the dominance of the private insurance giant, United Health, who have the former president for global expansion as the chief executive of the NHS, an insurance global expansion expert as in charge of the NHS. And this legislation, which will help the insurance industry capture control irreversibly of the public funding that goes into the NHS. So the NHS will be, as the Letwin plan always intended back from the 1980s, is to transform the NHS into a budget and a logo and not provide anything itself. And this is what the Labour Party should be jumping up and down about if they were sincere. But we mustn't forget, New Labour spent 13 years helping this process through. Jonathan Ashworth has been, I could think of very colourful language to describe his performance, but let's say weak in terms of making the case for what's actually going on. So I can only interpret this as them being complicit. That's the only way you can. That's the only way you can understand what's going on here.
I mean, we get that that language, don't we, from Keir Starmer, where he says that if you don't argue against something, then you're in favour of it. If you don't, he's got this kind of, it's binary. And I would say that what you've just said is that Labour's got some kind of connection maybe with private healthcare. And I'd like to, I'm going to come back, I'm going to bring you back in, Bob. I just wanted to get some information from Nicholas Csergo.
Yeah, that'll do for my surname. Yeah.
Did I get it wrong?
No, it's or Csergo. It's Hungarian.
Csergo. Nicholas, you were on a show before about lobbying, and you also talked when Dr. Bob was on a couple of weeks ago. But does Labour have a connection with lobbyists for the private healthcare industry? Yeah,
I remember on that particular, the lobbying program, the point I was trying to make, I'll try and elaborate on a little bit, is that it's not so much that you have, a society where the entire establishment supports the health service as it would have done, a number of decades ago. Even reluctantly on the Tories' part, there was a kind of acceptance that it was, it was something that the public wanted and a respect for it. That it's the opposite that pertains. So really, if you're it's unless you really stand out and make a big effort to stand out, and then you'll tend to fall in line with the dominant narratives, like for example, all the MPs, the Labour MPs on the Jeremy Corbyn got their briefings on the health service from the Nuffield Trust and the King's Fund, who have very good statistics. It's like if you're a left wing and you read The Economist, it has good information, but that it's a right wing publication. So they have been actively, they have been actively involved in transforming the health service towards the US model that is being rubber stamped by this legislation, which I think is really important to focus on. Sarah Sultana's motion mentioned this, and the Starmer Ashworth motion didn't, is that it's a model that incentivizes, it rewards cuts to care and closure of services and so on. It actively seeks, it gives, you get a slice of the money that would have been spent on a service if you cut the service. And this is what integrated care is, the US style integrated care or accountable care or whatever name it has. So I'm just saying you need to start from the perspective that everything's pro-private healthcare unless you stand out and you say you're not. And Corbyn was that exception, and Bernie Sanders a bit of an exception in the US in that respect. But that if you wanted to do something like Corbyn tried to do, at least for a bit, is to have a pro NHS approach. You need to be facing down, you need to be finding where there are people on the left who are writing about the health service and who have the right analysis, and you need to kind of start from scratch, because it's not what's out there. I hope that I've partially answered. I might not quite answered.
Well, no, I mean, with the lobbying, I'm just thought there was a name of a guy that was put out there who's funded Labour Together, I think, and also helped to fund Keir Starmer's campaign leader,
Martin Taylor.
Martin Taylor, yeah. Apparently, he's a big player in private healthcare. Sure.
Well, from what I've read, his hedge fund has invested in United Health. As it expects that to be some kind of return, I suppose. Yeah, possibly here. And they backed Starmer, so it makes sense that somebody who has investments in that would want to not back the Corbyn exception. It would make sense that you would want to back somebody who's not going to try and break with a consensus on healthcare that we have across the parties. Right. So that to me, that's a perspective. Yeah, I mean, we know that Starmer had this private healthcare lobbyist working for him. That when he was questioned about it by somebody in his campaign, he tried to change the subject. He wouldn't, he wouldn't question it. But I think it's less, I'm sure you can find more stuff like that if you look. But I think it's less a question of finding, they have a secret person who is planning to destroy the NHS, rather than they are completely in line with the policies that are destroying the NHS. And I do want to say the vote the other day was for a restructuring that's largely already happened, and it's been over the last 7 years. So the question when Corbyn came in was, will they break with it was based on a consensus. It was announced in Parliament, as I mentioned last time. Andy Burnham said accountable care organisations, there are policies developed by this side of the House, and Simon Stevens has recognised that he had cross-party support to push it through. And even under Jeremy, there was, had Heidi Alexander, campaigners were trying to get her to oppose this. She wouldn't. Only Diane Abbott opposed what was then called sustainability and transformation plans, systematic closures of basically unprofitable services. A rough part of it, overall idea is to get services out of hospital. You've heard this a lot. We need to get services out of hospital. And you don't go to A&E, don't go to A&E, go to an urgent care centre. Urgent care centres are profitable, A&Es are not. They're closing lots of A&Es. They're moving services to where they can be profitable. You can privatise a lot more out. Sorry, so the question was they had to break with that. And and just one more thing. Cameron was pretending to oppose the same stuff that Tony Blair was doing. And he started by pretending to oppose the hospital closure programs. And he turned that into something called top-down reorganisations. We were supposed to be really angry at something called top-down reorganisations, which smacks of saying the state shouldn't be in charge of healthcare. And the language here also suggests that. Yeah. And I'll close because there's two sides to what Ashworth is talking about. One is that Sajid Javid is bringing in powers that will enable him, as far as I understand it, to bypass Parliament, to do things that otherwise would have gone through Parliament. And another thing is saying, oh, the state shouldn't be in control of the health service. That should be in a quango like it is now. So I hope that's helped more than it's hindered.
Okay, all right. Thank you, Nicholas. Now, Dr. Bob, what do you think can be done on our part to stop this?
We need to see through the lies. We need to get a set of very simple messages. Our governments of various complexions over the last 3 or 4 decades have quietly set up the NHS no longer to provide healthcare, but to deliver profits for foreign corporations. This is a traitorous act. It's an unpatriotic act. And as a result, there will be thousands, if not tens of thousands, preventable deaths every year as a consequence. And it will be costing the individual more to have to top up insurance to make up for services that the NHS no longer provides. This will damage patients, it will damage staff who will suffer moral injury working in overstretched, under-resourced services, delivering poor care. So, the vast majority of the population stand to lose. The 1% who either hold senior positions in these new organizations or have major shareholdings in these organizations will do very well. And it's a utter disgrace that our opposition party isn't saying any of this.
Right. Well, thank you. I'm just going to move on to Tony Sullivan of Keep Our NHS Public. Tony, are you there?
Yes, I am. Hi, good morning.
Dr. Tony, sorry, a lot of doctors. What's your view from Keep Our NHS Public about Labour's response here?
Well, thanks very much for picking me to speak. I suppose my job, well, I used to be a paediatrician and working with disabled children and their families and working in Lewisham and Greenwich. And I suppose one of the things I had to do there was, can you hear me all right? Because my screen's frozen.
I can hear you, yeah. Can you hear me?
Sorry, yes. Can you hear me?
I can, yeah.
Okay, I'm sorry about that. So the job, I think, for Keep Our NHS Public is to look for all the weaknesses, but build on alliances and get everybody as much as you can to fight what's going on. And that's what we've done really since 2005. And we were set up during the Labour period where Tony Blair was starting privatisation and supporting PFI that John Major had started, and the independent sector treatment centres. So that's when Keep Our NHS Public saw the danger signs. But over the years, I think we've learned that you just have to fight, and if you fight, you can win. And now we've got 71 branches around the country. On July the 3rd, where it was the 73rd anniversary, we organised these events with health campaigns together. NHS Workers Say No, whose demand is for better pay, of course, as you know, and NHS Staff Voices. And I thought that was very optimistic in itself, that we could have 71 demonstrations or street rallies outside hospitals and town centres. I think we need to work more and more with the Labour Party, and the activists here need to, I'm sure everybody here realises that health should be a real unifying factor, because it brings together not just issues of privatisation and the undermining of universal healthcare, but also fights against cuts, fights about racism, migrant charges, the attacks on women's right to choose coming down the line, inequalities. And over the years, what I'm trying to say is that you can look at what's happening and you think, my God, we've lost it already. There is no hope. That, the Tory majority is 80. Labour hasn't been fighting nearly well enough, has been totally unclear about the dangers, and so we'll roll over and die. But over the last few years within this Tory Parliament, we've saved over 8 hospitals from closing. That's about 4,000, 5,000 hospital beds. And if we hadn't done that, it would have been even worse during COVID. In our own backyard in Lewisham, if Lewisham Hospital had closed, it would have been one A&E for 750,000 people, as Bob himself knows. So if we start from the premise that we can win, rather than just describe how much we're up against, then we start to think, how do we do that? And I think, someone like John Ashworth, who is definitely not flavour of the month, he is the Shadow Secretary of State. So Keep Our NHS Public has to go to him and brief him and push him in the right direction. We have to build alliances with left MPs. Like on Wednesday, we had this rally outside Parliament, Stop the Health and Care Bill.
Yeah.
And we had 100 people there. We had messages of support from
I think your signal's gone, Tony. Well, I'm going to we'll try and catch up with Tony maybe later on. I just wanted to quickly bring in Bonnie before we move on to speak to Prem Sikka. Bonnie, are you there?
I am indeed. Hi, Crispin.
Your signal looks better. So you've been involved in these sort of fight to save hospitals. I mean, this is like just what Tony was talking about. Because I mean, I know in West London we had Charing Cross Hospital was saved in a sense by fighting locally. Is that the way forward, do you think?
Well, it shouldn't be done on a hospital by hospital basis, but what we should be doing is looking at the example of the attacks on individual hospitals as part of a larger plan to remove the services we most need. In South West London, we're looking at losing all of the acute services from our 2 nearest hospitals in favour of one, they call it a facility. It's actually sort of a wing on the side of another hospital. This other hospital will provide, the facility in this other hospital will provide fewer than half the beds that we've currently got, including maternity beds, by the way. This is another attack on women's health. And they're moving services from the most deprived, the most ethnically diverse areas of Sutton and of Epsom and putting them in the most exclusive part of Sutton, meaning that it's going to be even harder for those people who need to access services more to get to them. The only way of getting access to these acute services is under blue light or by doctor's referral, which removes the ability to seek emergency treatment, which you might get from an A&E. And you know, it is about the individual fights, but it's painting a bigger picture. And to my view, what we saw in this bill that's going through at the moment was the biggest single attack was something that Jonathan Ashworth failed to even mention or cover. What it is if I can go back over some previous legislation, this is building on the 2012 Health and Social Care Act. And within the 2012 Health and Social Care Act, there was a provision under something called Section 75. And that meant that any services that were going to be contracted out had to undergo a proper tendering process and had to be some form of transparency. This new bill removes that need. This new bill means that NHS bosses can give contracts to whoever they really like to. And we've seen the danger of this throughout the coronavirus crisis, with Dido Harding getting reported £37 billion for a track and trace app, which is only now just working, and they're talking about winding it down because it is now reporting the cases that we're seeing out there. And we're going to see the embedding of cronyism, or corruption as it used to be called, money going to friends of the ministers and those at the top of the service. Where I am in southwest London, Epsom St Helier hospitals are going to be severely downgraded, having all of the acute services taken elsewhere. Now, at the last general election, the Conservatives were promising us 44, I think, new hospitals. The truth is they are not new hospitals. It's the closure of hospitals that already exist to provide fewer than 50% of the beds at great public expense for very little public benefit. And publicly owned NHS land is being sold off, at peppercorn prices, and will never be retrieved. Once it's sold, it's going to have, and we've seen this happening in Epsom already, very expensive private apartments built on the land that the NHS was bought to serve. And let's remember, when those hospitals were first established, the populations were considerably smaller than they are now. So we're seeing smaller facilities, fewer beds, fewer consultants, fewer nurses, to provide services to an ever-growing population. And it is the impact on the working class, the impact on minority ethnic bodies, and it's just a tax on women, on disabled people, and all of this, and it's cost, and we're paying for this, by the way. This is not for free, we're paying for this.